I'm Dr. Lisbeth Roy. Thank you very much for joining me. I'm very excited to talk to you about what we're doing here at Doctor's Studio to help women who have vaginal dryness or pain with intercourse. Maybe you're just not sensitive anymore, and so reaching climax is difficult, or having any interest in sex at all is difficult since it hurts. Some women will have these changes as they get older. A lot of young women actually have vaginal pain, and there's no dryness associated, but just some pain. So I've been using platelet-rich plasma now for quite a few years. I've taught hundreds of doctors how to use platelet-rich plasma to help these problems. And now I've introduced ThermiVa, which is a radio frequency technology. I'm using it with platelet-rich plasma, and it's just phenomenal. Whenever you put technology together, that's really where the science and the art collide. There are lots of different benefits to using radio frequency by itself, a lot of benefits of using platelet-rich plasma by itself. Both of the technologies actually stimulate a rejuvenation and a regeneration of tissue, improve blood flow. Both technologies will stimulate the Skene's glands to produce lubrication, and really more normal collagen. So both technologies help with sexual dysfunction with women. But when you put them together, it's awesome. It's as though the platelet-rich plasma fertilizes the whole process. And we know that these platelets are active even 10 weeks, 12 weeks later. And so each subsequent treatment with ThermiVa is further enhanced using platelet-rich plasma. So real quick, platelet-rich plasma is derived from your own blood. Platelets hold growth factors, and growth factors stimulate regeneration or rejuvenation. Just like if you're injured, that is the whole process of healing. So when we're trying to regenerate a tissue, whether it's vaginal tissue or tightened skin on the face, for instance, you want to stimulate collagen. So we draw your blood, we spin it in special equipment, and not all PRP is created equal. So make sure that whoever you're going to for your treatment is using the best type of platelet-rich plasma. Needs to have the right concentration of platelets, needs to have very high monocyte count, which are anti-inflammatory, and very low granulocyte, which is pro-inflammatory. You don't want to have red blood cells in your PRP. So it's a lot to it. I'll do another video just talking about platelet-rich plasma and how you, as a consumer, can really understand whether the provider is using the best according to the current science. And I think that's important, stay current with the science. So anyway, platelet-rich plasma is derived from your own blood. We draw your blood, we spin it in special equipment, and then we concentrate and take the platelets and inject it into the treatment area. So for women who have sexual dysfunction, there's a couple of injection sites, little modifications here and there depending upon what your issue is, but very, very successful. ThermiVa is radio frequency, which is not a new technology, but ThermiVa does an amazing job at this. The magic really is in the different hand pieces, as well as frequency and some of the details. So ThermiVa is heat, and we heat the tissues. When you heat the tissues and maintain that heat over time, you actually get regeneration, and you get stimulation of new collagen. You get just a more of a youthful function of the tissue. So you treat the internal vaginal canal. You also treat the external genitalia, so the labia. You can shrink and make more youthful the labia minora, the labia majora, so all of the external genitalia. You treat up and around the clitoris to enhance the blood flow to the clitoris and to regenerate the tissue in that area. We place PRP there as well, so we're going to create new vessels, even new blood flow, new nervous tissue. And all that sounds good, right? For sexual function, we have improved lubrication, improved sensitivity, ease of arousal changes, intensity of orgasm changes. So it's like the perfect storm. I'm very excited about putting these two technologies together, and I hope to have the opportunity to take care of you. Thank you.